Workforce reduction. That's what Sacred Heart Medical Center says it is in the process of doing. Hundreds of nurses were told to be at Sacred Heart this morning to find out what the future of their jobs would be.
KXLY4's Tori Brunetti live at Sacred Heart. And Tori, no nurses were laid off?
No, roughly 60 nurses were assigned to different departments. What happened today sounds very confusing. We're told hundreds of nurses lined up in a hallway and then, depending on seniority, were reassigned to different departments. This is what Monday morning looked like for the registered nurses at Sacred Heart. Crammed into a hallway for hours, waiting to be told if they needed to show up to work tomorrow. Last week, the nurses received a letter in the mail telling them this day was coming. Sacred Heart says it knew it was going to need to reduce its workforce, so the hospital has been keeping positions open for months, and today some nurses were asked to move to a different department. The nurses aren't the only ones put through this. Sacred Heart has been doing this with several departments in an effort to reduce staff and save money. This woman, who didn't want to be identified, went through the same thing last week.
We got into a room and had to wait for probably two hours before the meeting actually took place.
Then the people in her department were told one by one who got to stay in their current position, who would be moved, and who had to go.
It was very nerve-wracking.
That nerve-wracking feeling is something the majority of staff at Sacred Heart can relate to. Today was just the nurses' turn.
I feel for them. We have wonderful nurses, and I just pray that everybody is able to keep their jobs.
Sacred Heart says, like everyone else, they are struggling in this economy. They say they are dealing with increased charity care, declining use of healthcare services, and a reduced reimbursement to hospitals for state and federal programs such as Medicaid and Medicare. Live in Spokane, Tori Brunetti, KXLY4 HD News.